This is our presentation on exercise as medicine and why it should be integrated into healthcare.
My name is Karan Davis.
My name is Allie Moore.
I'm Erica Raymore.
I'm Megan Stang.
And I'm Danielle Willanen.
In our mission, the purpose of exercise as medicine is to prescribe exercises as a means of preventative and treatment measures. The aim is to connect, heal healthcare providers with fitness professionals and take advantage of all the benefits that exercise has to offer when it comes to living a healthy lifestyle.
So how will we be funding our program? Because we're located in an area that has a low socioeconomic status, we're going to be offering our workout classes and consultations for free for those people who are patients at the clinic. Our salaries for running our program are going to be paid for by the clinic itself, but this will be the only expense on the clinic's end. As far as obtaining equipment goes, we're going to be applying for grants and fundraising so that we're able to expand our horizons. And then once we have more equipment, we are hoping to be able to run a wider variety of classes.
So the patient flow looks like this. The patient is going to go to the doctor or their primary caregiver where they will have a check-in with them, and the doctor will determine whether or not they need to see us. And so they will refer the patient, you guys will refer the patient to us. And once that happens, we will be able to meet with them and give them a fitness assessment. And along with that, they'll need to fill out a fitness assessment data sheet and a physical activity vital sign form. And when they finish that, we'll be able to prescribe them an exercise plan. And after that, they'll be able to leave, and we will set up an appointment for about a month out, and they can come back and we can reassess and see if they need to have any tweaks with their exercise plan.
So this is the flyer that we're going to be handing out to those patients who are interested in our program. The clinic currently has 3 physicians, and each of those people see about 15 patients a day and spend an average of 20 minutes with each patient. So that adds up to about 5 hours of each physician's day is spent face-to-face with their patient, which already leaves them with little to no time to do things like charting or paperwork or any other tasks that they may have that need to be completed. So our goal is to not minimize the amount of patients or time spent with patients that the physicians currently have, but we still want to integrate exercise into these patients' lives. So we're going to accomplish this by having physicians tell their clients about us if they're interested. They will give this flyer to them. And by having us here to do the educational side of things, the physicians don't have to take any extra time out of their days, and the patients will be able to come to us as the experts with any questions that they may have about exercise and how to get started.
Along with the flyer, we will also hand out informative brochures to current patients and prospective patients. This half of the brochure is basically just the title page. We have a summary of the whole entire brochure in the middle, and then on the left side, we offered local fitness centers if they prefer not to attend the clinic for the free classes. Under the list of places, we offered a key of services that shows what each facility offers. And then on the second half of the brochure, we explain what the Exercise as Medicine initiative is, what the 4-step implementation means to them, and it also lists benefits of participating in exercise recommendations based off of the ACSM guidelines, and then exercise suggestions. We hope by informing patients that exercise improves memory and brain function, protects against chronic diseases, aids in weight management, lowers blood sugar as well, and improves heart health, improves your quality of sleep, reduces feelings of anxiety and depression, combats cancer-related fatigue, improves joint pain and stiffness, maintains muscle strength and balance, and increases lifespan, that they gain the competence and motivation to participate in exercise consistently. Additionally, providing the ACSM recommendations and exercise suggestions gives the patient freedom to choose what activity they want to do and for how long, while still staying inside those recommendations, which also helps with motivation and adherence.
In healthy adults from ages of 18 to 65 years old, ACSM recommends moderate intensity physical activity at least 30 minutes per day on at least 5 days per week. This would be equal to around 150 to 300 minutes of activity per week. Or ACSM says that if the person chooses to do vigorous intensity activity, they would only need to complete around 20 minutes of physical activity per day on at least 3 days per week, and this would be equal to around 75 to 150 minutes per week. As far as ACSM recommendations for morbidities, it does change slightly with each morbidity. As far as cardiovascular disease, exercise can reduce this disease by 20 to 30%, which is extremely important as 1 in 3 American adults do have CVD. It is still recommended that patients with CVD or those trying to prevent this disease exercise between 150 to 300 minutes per week at a moderate intensity. Those who cannot complete this amount of time, ACSM still recommends that they exercise, they just do as much as they are able. The US also has a very high rate of obesity, so it is imperative that we focus on exercise to prevent or reduce weight gain. Again, it's recommended that patients or clients perform at least 150 minutes of physical activity per week. As far as dyslipidemia goes, recommendations can change slightly depending on the patient's situation. If they have high LDL rates, they should complete at least 250 to 300 minutes per week of moderate intensity exercise. However, if they have a high HDL rating, they should exercise as often as they can at a moderate intensity. And if they struggle with high triglyceride rates, they should exercise between 30 to 45 minutes before or after eating a fatty meal. We know that hypertension is a common cause of cardiovascular disease, which we know is a very high morbidity in the US. If we can decrease blood pressure, we can also decrease the risk of CVD. Aerobic exercise can help reduce blood pressure by 5 to 7 millimeters per mercury in those with hypertension. ACSM recommends aerobic exercise 5 to 7 days per week, resistance exercise 2 to 3 days per week, and flexibility exercise around 2 to 3 days per week. Finally, looking at type 2 diabetes, for those with this morbidity that are looking to lose weight, it's recommended that they exercise at a moderate intensity for around 4 to 5 days per week. It would benefit the patient to be active in small amounts throughout the day, as that can help manage blood glucose and insulin levels. High intensity resistance exercise is often recommended for those with type 2 diabetes because it can benefit them more than moderate intensity exercise. It is also suggested that those with this morbidity should increase their activity level around meal times to reduce their blood glucose.
To start off, we will be offering yoga or a flexibility focused class at the clinic. We will also be offering a resistance training class that will incorporate muscle strength and muscular endurance, and then a Zumba or cardio focused class with the intent of instructing multiple people at once. Each workout will offer various progressions and regressions. This will allow all fitness levels to participate and improve on their own health.
The sign-up sheet is pretty easy to work with. When you click the link, then the sheet will open up as the picture is displayed above. And with that sheet, it is pretty easy to fill out. You just go ahead and you type in your name. You display the information of why you came, if you came for your consultation or if you're coming for your fitness class. And you each get like a 30-minute slot, and it's a good one-on-one experience to get on with the fitness instructor and to, get down some of the things that you have written in your plan. And when you're attending your classes, on the far left side, you can see what times are available going all the way down, starting from 7 a.m., going down to 5 p.m. And go ahead, when you sign up, you enter in your number, and you could possibly send your email as well if you want to get email updates on what's going on. And when you have that, we'll go ahead and give you a couple texts to leading up to your appointment. And yeah, after you did those short steps, get in contact with you and work on your training.
So why is medicine important? It's important because it will minimize risks of diseases that occur in the life of a patient. For instance, as we said before, type 2 diabetes and cardiovascular disease, those are two examples. When being active, these risks reduce. If the patient currently has any of these diseases, it will reduce the symptoms also. Exercise can be a better option than medication, and even though medicine can have some risk factors, but when a patient is working with a physician and a medical team, the major side effects are definitely reduced. This can not only treat but prevent diseases as well.
So why should you as the clinic take us on? Taking us on has some major potentials to increase the clinic's revenue. This extra revenue partially is what is going to go towards paying our salaries. This way, you guys as the clinic are not actually losing any money by taking us on. Using exercise as treatment will also equal healthier patients, which is every physician's goal. Taking us on instead of using your current physicians will help them to save time. This time will ensure that no face-to-face time is taken away from their current patients and opens up the possibility to potentially take on more patients. The flow that we have provided will allow exercise professionals to handle the exercise prescription, as well as one of the barriers that your clinic has is patients being uneducated and in EIM prescription. And we don't want to take away time that physicians spend with patients to educate them. However, it is also expected that through the process of working with us that your staff will become more knowledgeable in what EIM is and why it's important. We would like you guys to kind of think of us as a drug rep, but for exercise. You all currently spend time with pharmaceutical reps to discuss drug-based treatment for your patients, and our program is nothing different when drugs are replaced with exercise. The biggest pro with using our EIM system is that it can help to not only treat, but to prevent disease. All physicians want their patients to be healthy, and this system is a step in that direction. And these are our references that we used.